Talk Africa. AIDS is no longer a death sentence, but the fight to end it is under threat. The United Nations Global AIDS Report traces the tremendous progress that has been achieved. New infections are down by 60%, but there is still a lot of work to be done.
The HIV response is far from over. And even if the world succeeds in ending AIDS as a public health threat by 2030, over 30 million people will be living with HIV in 2050.
What will it take to win the fight against AIDS? What can African countries do to help lead the way? Straight Talk Africa starts right now. Hello and welcome to Straight Talk Africa. I'm your host, Vincent Makori. What will it take to win the fight against AIDS? The numbers at first glance look good. Infections are down 60% since 1995. In 2023, 30.7 million people had access to antiretroviral treatment. That is 7.7 million more than in 2010, but still short of the 34 million target that UNAIDS has for 2025.
The world is not on track. Global new HIV infections in our report are shown as not declining fast enough, and in 3 regions of the world in particular, infections are rising: Eastern Europe and Central Asia, the Middle East and North Africa, and Latin America.
Well, in the UNAIDS report titled "The Urgency of Now," for the first time in the history of the HIV/AIDS pandemic, the sharpest decline in new infections were in sub-Saharan Africa. 80% of new infections were outside sub-Saharan Africa, in regions like the Middle East and North Africa, Eastern Europe, Central Asia, and Latin America. Currently, the world has the knowledge and the tools to end AIDS, so why aren't we doing better? For insight into the fight to end AIDS, we are joined by Angeli Achrekar, Deputy Executive Director for the Program Branch UNAIDS, and Chip Lyons, President and CEO of the Elizabeth Glaser Pediatric AIDS Foundation. They are both joining us from Munich in Germany, where UNAIDS is presenting its executive summary on the state of AIDS in the world. Welcome to both of you.
Thank you very much.
Or should I say willkommen? Let me begin with you, Ms. Achrekar. See, in 2016, the United Nations member states committed to implement a bold agenda to end the AIDS epidemic by 2030. Now, we're about just 6 years away from 2030. Where do things stand as we speak?
Hello from Munich. It's great to be with you, Vincent, and thank you so much for the question. Where we stand right now is truly at a crossroads, and really the success or failure will be determined by the path that leaders take today. The fact that 2025, the targets that really are milestones to get us to 2030, are showing that while we're making tremendous progress, there are still significant gaps that remain to get to 2025, means that we really are at a crossroads now, and that we must accelerate our efforts right now if we're going to be able to make the 2025 targets in order to ensure that we fulfill the promise of ending AIDS as a public health threat by 2030.
Mm-hmm. And, you know, Mr. Lyons, you're dealing with a very delicate population, the demographic, especially of kids. But at the same time, we mentioned in our introduction there that UNAIDS report, Urgency of Now, shows that for the first time in the history of the HIV/AIDS pandemic, the sharpest decline in infections were in sub-Saharan Africa. To the best of your knowledge, what did Africa do right?
Africa did a lot of things right. Vincent, thank you very much for including me in this discussion. A number of countries just took the virus very, very seriously. And so what that means is they prioritized the policies, the strategies, they communicated accurately about how to prevent new infections, how best to test and treat those that were exposed to the virus. The thing about HIV and AIDS is it requires persistence. You just have to stay at it. I noticed in your opening, you made reference to sort of data from 1995 or progress since 1995 and 2010. At that time, AIDS was a crisis. It was an emergency. It was existential for some countries. I think where we've slipped is that we've taken for granted that progress is being made, because every year we did make progress. But with HIV and AIDS, you can't avert your eyes. You cannot move on to other things because there isn't a vaccine and there isn't a cure. And so you just have to continue those things that work around protection, testing, and treatment. And a number of countries, and we should call out Eastern and Southern Africa as a region, really put together a complete sort of set of strategies and policies. I would put an asterisk on that because children are still falling way behind where adults are. But when you see a country achieving 95, 97% testing rates and knowledge of individual status and so on, I mean, in 2010, that was almost unthinkable. It was aspirational. And so a number of countries have really done remarkable work to get us to this point.
Yes.
Angeli is absolutely right. We're at a pivot point, though, a
Yes.
crucial one.
Right, and of course, I think you're also making reference to that achievement by at least seven African countries of the 95 targets. Maybe you want to break that down a little bit. But in terms of how that was achieved, what was it? We want to see where is the interaction between what you're doing, what governments are doing on the ground, and what individuals are doing, what has been learned from those seven countries.
Those seven countries had support and partnerships, not least from PEPFAR, the President's Emergency Program for AIDS Relief, ministries of health in the lead, communities engaged, public knowledge about the virus itself, how to prevent it, how to manage it, the importance of testing, and so on, and just persisted month in, month out in that. Again, I would emphasize, if it's dangerous to think that we've got a handle on it at some point. You just have to continue to do the things that work. Partnerships are essential, private sector, government, funders, and so on. And those things came together probably as well or better in sub-Saharan Africa, Eastern and Southern Africa than as any other place.
Thank you. I wanted also Ms. Achrekar to chime in on this.
Yeah, thanks so much. And I appreciate coming in here, and I definitely agree with what Chip has been saying as well. Africa has really provided, they've been trailblazers. Countries in Africa have truly been trailblazers on the path to end AIDS. There are a few things that I would add in addition to what Chip had said. The level of solidarity that has come together in Africa from the beginning of the epidemic, early in the 2000s, early 2000s, that political leadership, that political commitment, prioritizing people at the center of the HIV response, and delivering programs with urgency and in a very people-centered manner, with partnership with PEPFAR, with the Global Fund, with UNAIDS, with incredible partners like EGPATH that Chip represents, but so many others, working hand in hand with countries, with governments, with communities to deliver services with urgency. That attention, that focus, that commitment and resources is what brought those countries with the progress that they've had. I want to be, sorry, go ahead.
No, and I wanted you to complete your thought, and then I'll ask you the next question.
The thing that worries me, this was a concern I was going to raise. The thing that worries me, Vincent, is that we still, despite all the progress, we still have 1.3 million new HIV infections globally. We have over 3,900 HIV new infections that are happening among adolescent girls and young women in the continent of Africa weekly. This is problematic, and we still have 9.3 million people that are living with HIV that do not have access to life-saving treatment yet, the majority of which are also in Africa. So the progress needs to be celebrated, but we cannot take our foot off the pedal because we have to still deliver for children, for adolescent girls and young women, key populations, and others.
And before we can talk about what must be done and why it's not being done, Mr. Lyons, in terms of the infections among the younger population, what is the explanation? What's going on?
Well, I want to refer to the report that you did from UNAIDS and their partners that came out this week because titled The Urgency of Now. What absolutely jumps off the pages there is the lack of urgency around children in the HIV response. 50% of kids are not on treatment, and half of those that are on treatment are not virally suppressed. There are big gaps in testing and treatment and reduction of viral load. It's just remarkable. It's outrageous. It's almost as if the plan was to treat children as second-class citizens, and the plan is working. But that was never the plan, nor the intention. And so what we have to do is to get back to a focus on children in terms of goal setting, in terms of strategy, in terms of policy and investment and funding. To your particular point of what needs to be done, we need to continue to strengthen the data around kids. We need to know more about where those kids are and to find them, their families, and within the community. We need to increase the testing for all pregnant and breastfeeding women for vertical transmission from mom to baby. That's where we can intervene, and an HIV positive woman on treatment getting proper care is going to have a small chance of transmitting the virus to her newborn and to continue that during the breastfeeding period. We need to get those kids on treatment immediately as soon as their status is known. Engaging the community, bringing a greater awareness of the gap that exists for children. And I emphasize that because we want to celebrate the progress, but we can't allow that message of progress to get in the way of the reality of where we are. And we have to talk about Africa in regions and countries, not just continentally. The picture is different in West and Central Africa, and there's even more work to be done in that area.
Sure. And we'll do some reality check, but it's time for a short break. When we return, we'll continue our discussion how we can win the fight against AIDS. Stay with us.
In times of change, when the world seems uncertain and what we hear doesn't reflect what we see, we seek the truth. When we are told only part of the story, we lose trust. In moments of crisis, our dreams, hopes, and wishes for a better tomorrow depends on a free press. At Voice of America, we bring you the stories that people take risks to see. We connect the world and unite it with truth. At Voice of America, we show you the whole picture.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linor Moudou, in Washington, every week on Healthy Living, right here on VOA.
You're watching VOA's Red Carpet. My name is Jackson Vunganyi. Thank you so much for joining us each week right here on Red Carpet. We bring you the latest in
Welcome back. We're talking about how the world can win the fight to end AIDS, and if there is the political will to do so. We are joined by Angeli Achrekar, Deputy Executive Director for the Program Branch, UNAIDS, and Chip Lyons, President and CEO of the Elizabeth Glaser Pediatric AIDS Foundation. Now, we are talking about how best to really continue the fight while we celebrate the gains. Now, there are set time-bound targets that and actions that are needed to be achieved by 2025, according to your report, UNAIDS, in order for the world to really fast-track the end of HIV/AIDS. What's the report card, Ms. Achrekar?
Thanks so much, Vincent. You're right. This particular report that we put out this week here in Munich is really a midterm look at where we are in the global AIDS strategy, where we are getting to the 2025 targets, where we are as the world getting to the 2025 targets, which is a clear marker in terms of whether it's possible or not to get to 2030. And so what we're seeing, the report card, is it's patchy. As we've been sharing, we're seeing a lot of progress in Africa, like we talked about, really being trailblazers in this fight. But we're seeing differences, big differences, across countries, across populations, groups of people being left behind on the continent of Africa. We see sub-Saharan Africa doing quite well on the treatment of people living with HIV. We're seeing new infections also declining among populations, men also in treatment. So as we were saying earlier, it's really important that we continue to look very granularly to make sure we're looking at sub-national efforts. What's happening at the provincial level? What's happening at the district level? What's happening in communities and with specific populations? So the report card is quite patchy, doing great in some ways, but not enough and not fast enough in others.
Yes, and we know that a key component in fighting HIV and AIDS is funding. And Mr. Lyons, we know that here in the U.S., there has been a lot of debate, especially over PEPFAR funding, and some people have issues over where it should be used, who should receive these funds, and so the politics, internal politics, can have some implications on the allocations. What has been your concern? What is the state of PEPFAR as we speak?
PEPFAR is a program that's unprecedented in the history of the United States, not just in terms of public health, but as an investment and as a commitment across 2 decades. And any time you have that kind of investment and sort of courageous leadership, in this case on the part of President Bush and members of Congress and so on, they want to see results. They've seen results. They continue to see results. And those results, I think, are going to drive the continued support from the United States. There is, though, the question of the long-term sustainability of these programs. Let's remember when we say ending by 2030, ending the epidemic as a public health crisis, that's ending AIDS as a public health crisis. HIV will continue until there is a cure or a vaccine. So there's a duty to care for the 30+ million people who are on treatment now and the additional millions that will go on treatment. The worst thing from a public health point of view and an investment point of view would be to cut off support for PEPFAR. too early, too fast, in the wrong areas, that will only rebound in the most negative ways, in lives lost, in costs to get back to levels of prevention and testing and treatment. And those that are most committed to PEPFAR, they know that. They've visited the continent and other regions many times. So the dialogue, the results, the additional work that has to be done, that's a part of the important work that we will continue to do in Washington, regardless of who's in the White House. You know, Americans and the rest of the world think in terms of Republicans and Democrats. PEPFAR was announced by a Republican. PEPFAR was supported by Democrat and Republican Congresses, and we need to keep up that level of support based on results, based on public health need, based on self-interest, and as a reflection of the values of Americans in terms of how they want to engage and support the rest of the world. And let us all say, let's make sure that includes the children, for goodness sakes. Children and adolescents.
Yes, very, very sensitive area. Ms. Achrekar, you know, sometime back there was a commitment to increase the overall investment from what was $19 billion way back in 2014 to $26 billion annually. To what extent have member states supported that call, heeded the call to increase that investment?
Yeah, it's a really important question because, as Chip said, we not only have a responsibility as a global community to end AIDS as a public health threat by 2030, but we have a moral imperative and a responsibility to the citizens of the world to sustain the gains beyond 2030. There will continue to be millions of people that are in need of treatment beyond 2030. And there will continue to be new infections unless we accelerate and really stop the new infections. So we have a moral responsibility. The UNAIDS is very concerned about the funding available for the HIV response. Around the world, funding is shrinking. It's holding back the progress that we see, even while we're seeing epidemics rising in certain countries or in certain populations. As we were just talking about PEPFAR, I want to just say that, you know, it's not only one of the greatest examples of leadership within the US, it's one of the greatest and most extraordinary examples across the entire world. We have never seen anything like PEPFAR and the leadership and support and continued leadership and support of the US government, together with partner governments, partner countries across Africa and across the world, together with UN and Global Fund. You know, having invested $110 billion over the course of PEPFAR is nothing short of extraordinary, the majority of which has been on the African continent. So when we talk about, you know, the concern that we have right now, globally, we are still $9.5 billion short of what the world committed to, as you said earlier, of that $26 billion annual commitment. This is really concerning. So we call upon all countries, we call upon leadership within Africa and around the globe, and within the US and around the world, to continue to invest in the most extraordinary response that we have ever seen. The last thing I'll just say, Vincent, is that when we look at the Sustainable Development Goals that the entire world has agreed to, including every country in Africa, this is one of the most extraordinary stories, because SDG 3.3 is one of the only among the 17 Sustainable Development Goals that's actually moving in the right direction. We have the chance of fulfilling the promise, but we cannot stop now, and we cannot stop the investment and the continued support.
Yes. Now, Mr. Lyons, let's do some reality check here. You did mention that while there are celebrations of the achievements, we cannot neglect the fact that some countries, some regions are not doing that well. What areas do people need to pay attention to? What is it that those countries, those demographics, those governments haven't done that they need to do urgently, and especially to save the lives of the younger members of society as we move forward?
I'm glad you broke it down that way, because there are very different experiences and data, particularly in West and Central Africa, where we are seeing the levels of relative to the goals of 95, 95, 95, knowing your status, being on treatment and being virally suppressed, are far, far below where they need to be. So first and foremost, it needs to be elevated in those countries and in the subregions as a public health crisis that it is. You need to focus on the populations that are least in Africa. They need to be applied, but with a Nigerian flavor to it, with Nigerian colors, with Nigerian reality. I'm not trying to pick on Nigeria. That's true with a number of other countries in the region. But that's where the most progress is needed over the next period of time. That's where the most dialogue is needed. That's where the political leadership, political voices, community voices have to be loudest, because that's the region that's got most to do over the next period of time to be on track for a continental-wide pathway towards ending the epidemic as a crisis.
Well, thank you very much. You'll have to leave it right here. Thank you to both of you, Angeli Achrekar and Chip Lyons. Thanks to our affiliate stations for broadcasting Straight Talk Africa across the continent. I'll see you next time.